I'm going to close the door for privacy. I'm Allison. I'm going to be the nurse taking care of you today. I'm going to do a head-to-toe assessment. I'm going to be listening to your heart sounds, your lung sounds, doing a neuro exam, and it's going to take about 25 minutes. Is now a good time? Yes. Fantastic. Let me go ahead and verify your name and date of birth. Wonderful. Do you have any allergies?
Yep.
Do you have any pain today? And can you tell me where you are?
I'm in the lab.
Fantastic. And can you tell me why you're here?
To help with the head-to-toe.
Wonderful. And what's the date today?
31, 2019.
That is correct. So my patient is alert and oriented ×4. She appears her stated age. She's dressed appropriately for the weather. She's smiling, she's nodding, she's paying attention. She appears to be in a good mood. She appears to have bathed recently. She is very well groomed, so she appears to have good hygiene. She is also sitting upright. Her body appears to be symmetric. I don't see any obvious physical deformities. She is in no signs of distress. When she walked into the room, I saw that she had smooth, coordinated gait. She was able to bounce without the use of an assistive device, and her skin color is appropriate to ethnicity with pink undertones. At this time, I would take her vital signs. I would take her blood pressure, her heart rate, her temperature, her respirations, looking for chest rise and fall, as well as her SpO2, and all would be within normal limits. So now I'm going to look at your skin. If you could show me your arms. Fantastic. So skin color still looks appropriate to ethnicity. It is even throughout. I don't see any moles. I don't see any lesions or any tattoos. I don't see any piercings or wounds. So it's clean, dry, and intact. And then now I'm going to palpate. Skin is warm to touch bilaterally and has quick elastic recoil. Good skin turgor shows well hydration. Now I'm going to look at your nails. So your nails are clean. They are round. They are intact. Their angle is 160 degrees. No evidence of clubbing, as well as they got pink undertones. I'm going to press down. Capillary refill is less than 2 seconds. I'm going to now look at your head. Head is normal cephalic. It is midline to the body. It is symmetric. Also, the neck is midline to the body. I don't see any pulsations. I don't see any masses or any lesions. When she moves her neck, she appears to have no limitations of range of motion. And when I look at her face, her eyes are symmetric. Her nose is midline and is proportionate to the rest of her face. Her smile is symmetric. Her ears are symmetric, and the outer canthus lines up with, or the outer canthus of her eye lines up with the top of her ears. Additionally, looking into her hair, I don't see any infestations. It appears to have an even distribution. Is it okay if I palpate your head? Fantastic. So I don't feel any lumps, bumps, lesions. I still don't see any infestations either. So next I'm going to actually palpate your lymph nodes. Is it okay if I touch your face? Fantastic. So preauricular, postauricular, occipital, submental, submandibular, jugular-digastric, also called tonsillar, superficial cervical chain, deep cervical chain, and could you posterior cervical chain, and could you roll your shoulders forward? Fantastic. Supraclavicular, any tenderness? Fantastic. So I did not feel any palpable lymph nodes, and there was no lymphedema capping. Now I'm going to go ahead and move on to your eyes. So eyes are clean, dry, and intact. There's no redness, swelling, lesions, or exudates. Eyebrows are intact. There's no infestations. They are symmetric. Eyelashes are in place. They curl up and away, down and away. Eyelids are also symmetric. No signs of ptosis. Sclera is china white. And conjunctiva, if you go ahead and look up, has pink undertones, no redness noted, and it's pink, moist, and intact. So now I'm going to have you look straight ahead for me, and I'm going to look at your pupils. Pupils are intact. They are also equal in size. They are round. They're about 4 millimeters in size. And I'm going to shine a thin light. Very good. They react to light, and they do so consensually. And now follow my pen using just your eyes. Very good. And pupils constrict and converge, so accommodation is noted. And then I'm going to go ahead and look at your ears. So I'm going to put your hair behind your ears. So looking at the external ear, I don't see any redness, swelling, lesions, or exudate. I'm going to look down the external auditory meatus. I don't see any redness, swelling, lesions, or exudate. Have you had any, or do you use any hearing aids ever? Have you had any issues with hearing lately? Fantastic. I'm going to go ahead and pull up on the pen. I'm going to press the tragus. I'm going to look behind the ear for any skin breakdown. No skin breakdown noted. I'm going to palpate behind the ear any tenderness. I'm going to do the same thing to the other side. So I'm going to look at the external ear. I don't see any redness, swelling, lesions, or exudate. I'm going to look down the external auditory meatus, and I don't see any redness, swelling, lesions, or exudate. And then I notice you don't have any piercings in, but I do see some piercing holes, or openings for piercings. Now I'm going to pull on your pinna, press on your tragus, look behind your ear. Any tenderness when I did that? I don't see any skin breakdown behind the ear. I'm going to palpate behind. Any tenderness? Fantastic. Now I'm going to move on to your nose. So the nose is symmetric. It is midline to the body. It is proportionate to the rest of the facial features. On the external nose, I don't see any redness, swelling, lesions, or exudate. I'm going to have you look up. I don't see any foreign bodies. I don't see any septal deviation. I don't see any drainage. The mucous membranes of pink moist and intact. Could you go ahead and include one nostril, breathe in? Go ahead and include the other one, breathe in. Any issues with breathing in? And I can hear airflow, so nares are patent bilaterally. And then I'm going to go ahead and look at your mouth. So your lips are pink, moist, and intact. I'm going to have you open up. Alright, so I see the buccal mucosa is pink, moist, and intact. The tongue is pink, moist, and intact. Teeth are china white. Looking up on the hard and soft palate, the hard palate is pink with yellow undertones. The soft palate is pink with gray, the hard palate is pink with gray undertones, and the soft palate is pink with yellow undertones. Can you go ahead and say ah? Try to like ah. Very good. So the uvula is midline. It rises with phonation, and then the posterior pharyngeal wall is also pink, moist, and intact. And I don't see any redness, swelling, or exudate. And since the uvula rose with phonation, and it did so midline, and because there's no pooling of saliva in the back of the throat, cranial nerves 9 and 10 are intact. And so, since we have done your eyes, nose, mouth, and ears, we are ready to go on to your respiratory system. So, first I'm actually just going to inspect. So, looking at the chest wall, I see the costal angle appears to be about 90 degrees. Looking at the anterior to posterior diameter, anterior to posterior is about half the width of the transverse, so that tells me there's no barrel chest. Looking at your spine, you're sitting upright, your spine is straight in midline, there's no scoliosis, lordosis, or kyphosis. Also, you have even and symmetric respirations, so that tells me that you're not in any respiratory distress. Also, I don't see any accessory muscle use. So next I'm going to palpate. First I'll start with the anterior chest wall. Any tenderness? No masses felt. I'm going to take my stethoscope with me, which I have already cleaned. And I'm just first going to palpate the back. Any pain or tenderness? No masses, no bumps, no lumps felt. Next, I'm going to confirm symmetric chest expansion. So could you go ahead and take a deep breath in? Good. So I'm at T9, T10, and I felt the chest rise and fall with symmetric chest expansion bilaterally. Now, every time I place my hand on your back, would you please say 99? 99. Very good. So even vibrations, even tactile firmness felt throughout. Next, I'm going to go ahead and, since I'm already back here, I will start oscillating your lung sounds in the back. So every time you feel my stethoscope, please take a deep breath in and out. And I'm going to do it on bare skin, so take a deep breath in. And I'm at the left upper lobe, right upper lobe, and down, right upper lobe, left upper lobe, left lower lobe, left lower lobe, very good, left lower lobe, and the 8th spot, right lower lobe. Oh, sorry about that. Clear vesicular lung sounds heard throughout. Now I'm going to go ahead and oscillate on the front. So listen up here, going to deep breath in. Right upper lobe, left upper lobe, left upper lobe, right upper lobe. Could you go ahead and lift your arm up? Left lower lobe, and lift up. Go to my right middle lobe, right lower lobe, left lower lobe. Clear vesicular lung sounds heard throughout. And so I'm going to go ahead and move on to our cardiac system. So first I'm going to look at your neck. I don't see any pulsations. I don't see the carotid pulsation. I also don't see the jugular vein pulsation. If the jugular vein appeared distended, I would lay you back 45 degrees, but I don't see that right now. So I'm going to go ahead and palpate. 2+ regular rate and rhythm. 2+ regular rate and rhythm. And I don't see any signs that I should check for a bruit at this time. So now I'm going to inspect the chest wall. So looking at the chest wall, it appears symmetric. I don't see any heaves or lifts. So I could palpate for the chest wall for any thrills. No thrills noted. I'm going to auscultate in the 5 cardiac areas, first with my diaphragm and then with my bell. Aortic. Pulmonic. Herbs. And we go up under your shirt. Tricuspid. And mitral. Since I'm here, I'm going to go ahead and auscultate your apical pulse for a full minute. Apical pulse after a full minute is 60 beats per minute, and it has a regular rate and rhythm. S1 and S2 were noted. Next, I'm going to check for any murmurs or bruits or extra heart sounds. So, aortic, pulmonic, first point, up under your shirt, tricuspid, mitral. No S3 or S4 noted, also no murmurs or bruits were noted. So next I'm going to go ahead and palpate your radial pulse bilaterally. Thumbs up. 2+ regular rate and rhythm. So I'm going to go ahead and actually have you lay down so we can do your abdominal assessment. So I'm going to have you lift up your shirt. Thank you. So I'm looking at the abdomen, and if the abdomen is flat, it is symmetric and contour. I don't see any masses, I don't see any pulsations, I don't see any lesions, piercings, or tattoos. Skin color is appropriate to ethnicity with pink undertones, and I don't see any stretch marks or whatnot. Next, I'm going to auscultate the aorta for a bruit using my diaphragm, or my bell, my bell. No bruit noted. Going to move on to listening to your vowel sounds, starting in the right lower quadrant. Doing a side-to-side zigzag pattern, about 3 to 4 spots in each quadrant. Normal active vowel sounds heard throughout. Next, I'm going to go ahead and percuss. Generalized tympani heard throughout. I'm going to do light palpation. Do you have any tenderness when I do this? Wonderful. I'm looking for any guarding, any rigidity. You have very good skin tone and musculature. I don't feel any superficial masses and no guarding or rigidity noted. So you go ahead and put your shirt down. I'm actually going to have you stand up, and I'm going to do a musculoskeletal assessment. So first we're going to start out with range of motion, and we're going to do I will save your neck for when we do cranial nerves. So we will do your spine, shoulder, elbows, wrist, hands, hips, knees, and feet. So first I'm going to have you bend forward, touch your toes. Good, and bend backwards, lean to the side, lean to the opposite side, and go ahead and twist and rotate. Very good, full range of motion in your spine. Next we'll go ahead and do your shoulders. Can you take your arms forward and backwards? Take your hands behind your head, hand behind your back. You take your arms up like you're making a snow angel, and take it back and cross them, and then throw a softball, and throw another softball. Now we move on, full range of motion in the shoulders. So let's do the elbows, extend, flex, hold a cup of soup, flip that cup of soup over. Very good, full range of motion of the elbows. Now for wrist, go ahead and flex down, come up. No way, Jose or Taylor Swift, shake it off. Very good. Full range of motion of the wrist. For your hands, can you spread them out wide? Can you squeeze them together? Can you take your fingers to the opposing fingers? And then can you do party fingers? Woo! Great. Full range of motion in the hands and fingers. Now we will do the hips. Can you go ahead and kick forward with both legs? Good. Kick backwards. Sorry, give you some space. Can you kick up to the side and kick across? And then kick to the side and kick across. Very good. And then play happy sack with each leg. Very good. Or stanky leg. There you go. Then can you flex your knee and extend? Flex and extend. So full range of motion in the hips and knees. And then for your feet, could you go ahead and point, flex, take the body foot in and out. The other side, point, flex, in, out. So full range of motion in the ankles as well. So also while I was doing this, I was inspecting. I was seeing that it doesn't appear as though your joints have any deformities. There's no redness, no swelling. The skin around the joint appears to still have pink undertones. I don't see any swollen joints, any nodules. Do you have any tenderness? Good. I'm just going to palpate the joints, see if the joints are crepitus. Can you go ahead and bend this knee? Very good. No crepitus. Excellent. No crepitus noted. So next we're going to do some of the same range of motion we just did, but we're going to add resistance. Will you take your arms forward? Don't let me push you down. Take your arms backwards. Don't let me push you down. Put your arms behind your head. Don't let me pull you apart. And behind your back. Very good. And then arms out to the side in a T. Don't let me push you down. Don't let me push you up. Now extend your arms forward in a fist with your palms up. And now bend at the elbow. Pull me in. Pull, 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 pull. Very good. Now push me back out. Excellent. Now can you put your hands on my hands and press down like you're pushing a gas pedal. And then go ahead and pull back. Very good. So full range of motion in the shoulder, elbows, and wrist. 5 out of 5 in all those extremities. Then squeeze my hands. Squeeze, squeeze, squeeze. Very good. So full range of motion, full strength in the hands. 5 out of 5. You can go ahead and sit on the bed. And I'm going to test your hips. So go ahead and push my hands out. Good. And squeeze back in. Very good. I'm going to test your knees. So go ahead and kick forward. And then pull back in. Excellent. And then kick forward. Pull back in. Excellent. So full range of motion in the hips and knees and full strength against resistance. 5 out of 5 or 5 plus. I'm going to go under your feet. Can you press down like you're pushing on a car? Very good. Or like you're pushing a gas pedal. Then go ahead and take your toes up towards your nose. Pull, pull, pull. Very good. And full range of motion, full strength against resistance in your ankles as well. 5 out of 5 or 5 plus. So this time I would have you take off your shoes, but I'll go ahead and palpate the dorsal pedis. And it would be 2 plus with a regular rate and rhythm. Excellent. Now we're ready for your cranial nerves. So first, you want to close your eyes. Well, actually, before I do that, I want to test your mental status a little bit further. So can you please count backwards from 30 by 7s?
30, 23, 16, 9, and 2.
Excellent. So because she's alert and oriented and also can perform 0 sevens, that shows me calculations and attention and focus. So I believe her mental status appears to be intact. So can you go ahead and close your eyes and identify this smell for me? Excellent. Cranial nerve 1 is intact. Then could you please read the last line here? Thank you. Wonderful. Cranial nerve 2 is intact. Could you follow my pen light using just your eyes? Very good. I see smooth, coordinated movement, no presence of nystagmus or strabismus, so cranial nerves 3, 4, and 6 are intact. Now with cranial nerve 5, first I'm going to palpate your face, the temporomandibular joint. Can you open and close your jaw? Move it side to side. Can you protract and retract? Very good. The patient was able to move her jaw in all of those directions. Cranial nerve 5.